Right. So in next few minutes, I am going to talk about the acute management of poisoning in children. So my objectives are to understand the structured approach to the child with acute poisoning and to understand the protocol for the treatment of child with poisoning. So when we talk about the definition of poisoning, poisoning is a effect or a scenario, and the poison is a substance. So what is poison? What is a poison? Poison is a substance that can be toxic to a human being or human structure or human function in a small dose. So anything can be poisonous in large doses. But usually when we label a poison, that is a substance that can be poisonous, toxic in a small amount. So when a child presents with poisoning, there are various types of poisons that children are exposed to. Pharmaceutical agents, chemicals like agrochemicals, industrial chemicals, vehicle-related chemicals, household chemicals, plants, and animal products are some of those. So these poisons can be entered into the body in various ways. Ingestion is the commonest mode of poisoning in children, but inhalation and sometimes surface contact, either skin or mucous membrane contact, or injection of poisoning, like in snake bites and insect bite, are some of the routes of poisoning in children. When you manage poisoning, we have to go through the same protocol way as we manage the other emergencies. Like if there is a resuscitation is required, you can go through ABC, and the specific management of poisoning comes under D. So what is this? What are the steps of managing poisoning? There are three main steps. Those are decontamination, elimination, and detoxification. And supportive care comes other than the specific management of poisoning. This supportive care is extremely important because sometimes we cannot do decontamination and elimination due to the delayed presentation, and detoxification is not possible due to unavailability of antidotes. So extremely important, the supportive care in the management of the poisoning. So what is decontamination? Decontamination is removal of poison before entering into the circulation. That means if it is an ingestion, the removal from the gastrointestinal tract by whatever the mean, either by gastric lavage or single dose activated charcoal, and sometimes in developed countries they use endoscopic removal, comes under decontamination. Elimination is the removal of poison from the body, from the circulation, before the toxic effects. So when it is entered circulation, sometimes we take it out by dialysis or taking out of intrahepatic circulation or some diuresis. It removes from the circulation, that is known as elimination. Detoxification is neutralization of the poison with the antidote. That is a anti-toxic drug which can revert the toxic effect of the poison. And supportive care is whatever the support we can give: respiratory support, renal support, liver support, ventilate, cardiac support. Whatever the support is known as supportive care. So gastric lavage is one of the commonest method of removal of poison from the gastrointestinal tract. It is very social demanding process, but gradually disappearing from the protocols. It is effective only within 1 hour. Sometimes it is only within 2 hours. And it has to be performed with a very good airway protection, which is sometimes extremely difficult in some situations. It has to be done in a position of left lateral position, head down position with a very wide bore tube. For example, more than 24 gauge tube for a young infant because it is orogastric tube. I don't know whether this size tube is available in most of our pediatric units. And oral airway has to be inserted to prevent bite in the tube because it is orogastric tube. We use wide bore tubes because it is easy to remove the tube poison. And it is done with normal saline. Usually 10 to 20 ml of aliquots. That means sometimes the 5 ml per kg for these very small children. Usually 3-4 cycles, but ideally it has to be done until the effluent is clear. Sometimes when the poisonous substance is clear, it is very difficult to determine the number of cycles, but usually 3-4 cycles has to be done. It is a very socially demanding process, but the efficacy is not very much proven and very high rate of complications. It can cause aspiration. Sometimes the tube, because most of the poisonous substances are irritating substance, they damage the esophagus and it causes ulceration in esophagus. The esophageal perforation is common. Sometimes pneumothorax is, the patient can get the complication of pneumothorax. So ideally it has to be done by a very experienced person, senior person, if it is being done. So activated charcoal, it is a very effective method of removal of poisoning. It can be given in 2 ways. One method is giving by nasogastric tube within 2 hours of poisoning, single dose activated charcoal. The single dose activated charcoal is known as a procedure of decontamination because it decontaminates the gut from the top poison. The usual dose is 1 grams per kg. It can be given to drink or it can be given via orogastric or nasogastric tube. If you do gastric lavage, after the gastric lavage, you can put charcoal through the same tube and take out the tube. So that is single dose activated charcoal as a method of decontamination. Sometimes the charcoal is not effective for heavy metals, iron, lithium, mercury, cyanide, and other heavy metals. It is not effective for acid, alkali, and alcohols. So multiple dose activated charcoal is a method of elimination. It is not a method of decontamination because it is acted by either interrupting the enterohepatic circulation or enteroenteric circulation. So it takes the poison from the circulation, which is secreted into the gut and removed with charcoal. So it is an elimination technique because it takes out the poison from the gut, from the circulation through the gut. So it may reduce the absorption of controlled release drugs and other and oleander seed-like substances, but it is effective for many poisons as a method of elimination. The dose is the same, like single dose, like 1 to 2 grams per kilogram. So it can be repeated in every 4 hours till the poisonous toxic level is significantly low. There are other methods of elimination as well. Forced urinary and alkaline enuresis, saline diuresis, multiple dose charcoal, the hemodialysis or peritoneal dialysis, usually hemodialysis, intracorporeal removal of drugs, and charcoal hemoperfusion. These procedures are done in advanced toxicology centers for certain poisons. So detoxification. Detoxification is done with antidotes. I have listed out some antidotes. Protamine for heparin, desferrexamine for iron, pyridoxine for isoniazid, penicillamine for lead, methylene blue for methemoglobin, ethanol for methanol, folinic acid for methotrexate, naloxone for narcotics, atropine and pralidoxime for opioids, N-acetylcysteine for paracetamol, alkaline agents for tricyclic antidepressants, glucagon for beta blockers, fluoxetine for benzodiazepines, calcium chloride for calcium channel blockers, penicillamine for copper, oxygen for carbon monoxide, diazepam for chloroquine, naloxone for clonidine, cyanide for thiosulfate, atropine and digibond for digoxin, ethanol for ethylene glycol, calcium gluconate for fluoride. So these are some of the principles of managing of poisons. Are there any questions so far regarding the basic management of poisons? If you have any questions, can you send me, please? Because I want to discuss few situations, few examples of poisoning. Uh, any questions? Okay. So now I am, then in summary, if there is a poisoning, the resuscitate if applicable with A, B, C steps, and the management of poisoning comes under D and E. Decontamination within 1 hour, elimination within 2 hours, detoxification if antidotes are available, supportive care always depending on the organ failure. So I am going to discuss about several examples for poisoning. Very briefly, I am going to discuss. Paracetamol is one of the commonest acute poisoning in children. So paracetamol levels are available in some centers and in private sector. Certain government hospitals also it is available. So if you take it as a dose, more than 200 milligrams per kg in a single dose is taken as poisoning, high poison. It can cause severe liver failure. If patient presents early, within 2 hours, activated charcoal can be given. The antidote is N-acetylcysteine, 2 bags standard infusion, and treatment endpoint is when INR is less than 2, ALT is less than 50, or serum paracetamol level is less than 10 grams per deciliter, milligrams per deciliter. Kerosene oil is another common agent in pediatric age group. May need breathing supports and local decontamination, but it should be avoided. The gastric lavage should be avoided. Charcoal should be avoided. Using steroids and antibiotics, no convincing evidence, but depending on the bronchospasm and respiratory difficulty, it can be tried in some situations. Salicylate is one of the extremely common poison, and gastric lavage can be applied within 2 hours, and repeated salicylate measurements should be done if available. Depending on the symptoms and the metabolic derangements, supportive care has to be given, and urine alkalization with aiming urine pH above 7.5, and urine output 3 to 6 ml per kg per hour has to be done. Hemodialysis and plasmapheresis has to be done. It is a fatal toxic agent. It comes as aspirin in tablets, methyl salicylate in oil and ointments. It is not uncommon. It is one of the common acute fatal poisoning in toxicology. Oleander causes heart block. It contains digoxin-like substance. So if patient presents with bradycardia and atropine, cardiac pacing and anti-digibond antibodies can be given. Iron is another fatal toxic agent in children. So we can try gastric lavage, but not very effective. Charcoal has no use. In developed countries, endoscopic removal is being done. And 4-hour post-injection iron level should be less than 3. If it is more than 3, it indicates severe poisoning. And IV dexamethasone is the antidote. Sometimes patient needed intubation and ventilation and circulatory support. Opiates can cause respiratory depression and cardiac depression. Naloxone is the antidote. And normalizing carbon dioxide prevent ventricular arrhythmias with opioids. Ethylene glycol is a chemical substance. It is used in some vehicle anti-freeze chemicals in radiator coolants. So it causes metabolic acidosis in patients. And activated charcoal is ineffective. So ethanol is the treatment, and but it is not freely available. IV ethanol is not freely available in most of hospitals. Tricyclic antidepressants causes CNS and anticholinergic toxicity, and it causes cardiac arrhythmias, seizures. So activated charcoal can be used with secure airway if patient is drowsy. Plasma alkalization and hyperventilation can be used as treatment, and supportive care is the main method of treatment. Organophosphate, again, the common pesticide used in Sri Lanka. Poisoning is not uncommon. Patient comes with cholinergic effects. So respiratory support, decontamination, atropine and palidoxim are the antidotes. These are some of the examples I used to discuss discuss acute poisoning. So, in summary, the patient comes with acute poisoning, resuscitation if applicable, decontamination, elimination, detoxification, supportive care always to save life. So, there is a question in the chat asking, can gastric lavage and activated charcoal be used for any poison? Yes, it can be used together. So the question is not very clear. Can gastric lavage and activated charcoal be used for any poison? Yes, it can be used. So if you ask the question more specifically, I can give a more specific answer.
I think they are asking whether they can be used for any kind of poison, not for any kind of poison. You just mentioned only certain poisons.
Yes, a lot of pharmaceutical agents, except this some lithium and the metallic pharmaceuticals, it can be used. And many chemicals, it can be used unless it is a heavy metal hydrocarbon or alkaline acid we can't use, but other situations we can use both. Any other questions? Always use this principle of decontamination, elimination, and detoxification. The supportive care is the most important management in all poisonous situations. Because antidotes, though I mentioned, most of antidotes are not available freely in our hospitals. And most of the patients comes late. So the initial steps of decontamination, elimination cannot be done due to the late presentation. So in the absence of any questions, I can stop. So then thank you for listening. So can I finish it also?
Yeah, there's another question. The patient is well and asymptomatic.
Patient, what is the question? Is
If
that
the
a question?
patient, if the patient is well and asymptomatic, but the bystander claims to have an ingestion of poison, do we still treat?
If
Cannot quite
patient
sure
comes
what.
with patient is well and asymptomatic, sometimes we have to. It's like this, like iron. If they comes with if mother says that patient has swallowed 10 tablets of iron, then we have to consider treatment. In overseas, what they do is they do immediate endoscopy and see whether it is there. That's not all the poisons cause immediate effects. So we have to consider. But when we do the gastric lavage and we take tube, we can see whether it has been there. We have to observe for 24 hours whether the patient has toxic symptoms are mild or severe. We have to keep the patient 24 hours in the hospital and investigate. That is the duration of assessment in guidelines. And if bystander claims to have ingestion of a poison, we have to treat means we have to start at the treatment. Do we still do decontamination elimination based on the bystander's history? Yes, we have to, because we don't know, because poison effects toxic effects, suppose if a substance is a cardiotoxic drug, we can't, because the decontamination and elimination can done only within 2 hours. If it is within 2 hours, we have to try, because this but decontamination is a dangerous procedure. But charcoal can be given. Charcoal is not a toxic agent, so you can give no need to putting in a nasogastric tube. Charcoal can be given to the child to swallow. We have to do charcoal. We can't wait symptoms and signs comes because it takes time. If the poison is a serious very seriously toxic substance. Otherwise, legal problems comes if you don't do early management. Because the charcoal is not a toxic agent. We can give safely even for a patient who has not got severe toxic. Okay. Then shall I round up the session? I think this is the last presentation today for the day.
Yeah, thank you. There, this
Okay. Welcome,
very well presented. I think this comes to the end of the presentation. So you'll be assigned to intensive care units and emergency units for your practical work, and we will send you a post-course MCQ somewhere in the first week of April, and also some logbook to document what you have been doing practical sessions during the appointments and as well as during the internship. Okay, Roshanta, you want to hand?
Yeah, I think logbooks are
to
behaving.
finish.
Yeah,